Hi there, this is Dan Whitting and I'm at Saddleback Church in Lake Forest, California at a rather extraordinary event examining mental health in the church. People from different groups, different denominations are here to speak, and it's been very, very fascinating. But it came about when Matthew, who is the son of Kay and Rick Warren, committed suicide, and they began to realize what a problem mental health was, particularly in the church. And so each year they hold this conference, and we're delighted to bring you some of the interviews from the conference.
The issue gets very little attention in the political halls, and it gets very little budget priority. And we need to build a movement that makes mental health and better mental health treatment a priority in the society. Certainly we know we're paying a huge price for not doing so. When we see the increase in homelessness, when we see people cycle in and out of jail, when we see some of the terrible tragedies on our national news, it is time that mental health become the public health issue of our time.
And what role does religion play in all this?
If we're going to get those who make budget decisions and legislative decisions to act in the right way, we need the support of faith-based communities. And when I think about the reach of the Saddleback Church and Pastor Warren and Kay Warren and their commitment to this issue, it gives me great hope, because it tells me that we can reach millions of people who we might not otherwise reach. And this is tremendous. This is about coalition building. No one institution or part of society owns this issue. We all do. Next year, we want to use proceeds from the Mental Health Services Act more effectively to create a multi-billion-dollar bond for supportive housing for the homeless mentally ill.
Wonderful.
Because if we're going to really tackle the problem of homelessness and help people who are out on the street who are ill, we must have a housing first approach, and we have the resources to build more housing if we use those resources more effectively. That's our #1 mission next year.
What is the reason you're here?
Well, I want to echo what was just said, and that is government cannot do this alone. It's going to take an entire community made up of law enforcement professionals, made up of the community itself. Oftentimes we're the first contact, but we need support. And we can't just rely on government. We have to ask the community to come as a whole and support it. It's the community that is affected by these type of situations. Whether it's a negative contact in law enforcement, or somebody shoplifting, or whatever serious or minor it is, mental health affects a lot of people in this country.
So what is your main, your main reason? Is it that we need to understand many of these people who are arresting are sick?
Well, it's twofold. One, I'd love to see the stigma erased about mental health, and two, to find alternatives to putting these people in jail. The last place they need to be is in jail.
Yeah. So what do you hope should happen?
Well, I would hope that we could develop crisis intervention programs, and those crisis intervention programs would take another step and find alternative places for those folks to go. As was mentioned earlier, housing, clinical support, financial support, and just a holistic approach. It's not a single isolated problem.
Thank you so much.
My name is Rabbi Richard Steinberg. I'm the senior rabbi of Congregation Sher Malot in Irvine, California. And the invitation of Kay Warren, happy to be here. It's really quite simple. In the first chapter of the book of Genesis, it says we were all created in God's image. And God's image is the potential for all of us to live to our full potential. And our job as faith communities is to help people access that space in themselves and then bring them to their very best selves. And that's true of if you're ill with an illness, a cancer, a broken arm, or if your heart is broken, or if the wiring in your brain isn't right, or if your chemicals are out of whack. Our job is to help people and to literally give them a safe space. I mean, we call the prayer space the sanctuary, but really religious life ought to be a sanctuary for all people.